No one's job description says flood recovery, but we've just had a flood, so we better put it into our job description. So we came together, we figured out how to get a job done that we had never done before. What that did was that built an experience, it built a history that we can solve problems that we've nearly never dealt with before. So when COVID came, and COVID was completely new, none of us had job descriptions that said work effectively in a global pandemic. And yet it was here, but we weren't starting from scratch. We were building on a history of a couple key principles. Number one, adversity does create opportunities for innovation. And number two, a community that has trust can pull together in new and different ways to solve problems they never dealt with before.
That became a model, really, of bringing the community together. If all of a sudden I found a foundation, knew the people that were on the ground, they were out there doing things, watching what was going on. When we were getting ready to fund anything else regarding the flood, the first question was, well, what are we doing already? And we knew already where it was going, what was happening.
My phone rang, and it was the county manager asking what I thought about possibly using the Boys and Girls Club as a site for COVID-19 relief. And probably within 20 minutes of that, I was on the phone with Bob Careau of the Schenectady Foundation, talking about what this might look like, how we could pull this off. And within days, probably 2 or 3 days, we had the first meeting set up with Schenectady County and with the Schenectady Foundation and a slew of other nonprofits and others in town. And it was off the ground and running with goals set in that first meeting as to where we were headed.
I think as a community, we're always good at reacting fast and being collaborative, and that was absolutely the case when COVID started. I remember all of those early day phone calls, early in the morning, figuring out with the community how we were going to respond to this week to week, literally from day one. Focusing on safety, making sure all the staff had what they need, making sure the community was educated so they can make the best choices for themselves, and continuing to access the resources that they needed.
It is all of us putting aside our mission statements for the greater good of the community and being intentional about our support of each other and the community that we serve. So it was really good to see that this is what was happening.
Being able to get tangible resources to the community, whether it's through food, through the drive-through pantry, at a scale that we've never done before. Our community didn't say, well, how are we going to do this? I don't think that's for us. We're like, we're going to come together, and no matter what, we will be the ones making sure that our community gets food, that they stay housed, and that they stay safe. Even through cold weather challenges, making sure that it was socially distanced, etc. And it was a huge success and continued to be a model that we used over the next few years.
I don't think people realize how extensive the COVID-19 coalition really was. I mean, in a very short period of time, this coalition had established a hotline center in the Boys and Girls Club. The gymnasium was turned into a basic product packing warehouse. I know that the Boys and Girls Club, over time, will look back at that as maybe one of its finest moments in its history.
There's 3 things that come to mind really quickly for me. The first is that we were all in it together, making sure that the providers and staff were taking care of each other, that we were preserving as much as of our own mental health as we could, and knowing that we were in it together, even though it was this unprecedented level of need in our community, really made it manageable. The other piece is that we were able to keep people really safe as they moved through the shelter system. That was one of the first things that we identified as a need, making sure as people moved from hotels into shelter, into housing, when we had a communicable disease that we didn't know too much about, especially in early 2020, that we were coordinating, that we were using the guidance from the CDC and our great public health team here. And we were successful in that, in keeping COVID out of our shelter system and keeping people healthy. And then being able to use the funding we got from the Schenectady Foundation for our emergency fund. So through the One Schenectady efforts, we were able to serve on average 15 households a week with things like phone bills, medical payments, and rent.
What changed the foundation forever was in 2011 when Hurricanes Irene and Lee stormed into our area and created flooding in many areas of Schenectady County, including Rotterdam Junction, which was hit more profoundly than any other location. And that got us out of our ivory tower, that got us out of an arm's length sort of granting money to, we're working with you, we're working with our community organizations, we're working with residents on how to deal with crisis, a crisis that none of us had ever experienced before.
I'm so happy for what was accomplished for the community in terms of, over 100,000 meals and 16,500 care packages delivered to the homes of people that were in quarantine.
The foundation can't achieve its mission by itself. It's a partnership, and it has to be, everybody has to be working together toward the same goals.
What we did is we created a common culture amongst people that work with people in poverty. We also create a language for people in poverty to not only work to improve their lives, but to be at the leadership table. And I think the big barrier we broke down was siloed responses to community-wide problems. And so the leadership table was built and everybody had a place at it. And what we learned very quickly was everybody had a contribution to make. And so the landscape changed of who comes together to solve problems. And the folks themselves, particularly people who had experience with generational poverty, were not on the outside looking in. They were at the table. They were determining policy and direction, and they were being trained in leadership. Again, the foundation created that table, created hope for people who had never been in a problem-solving role, and we are still benefiting this many years later from the momentum that was built and the leaders that were trained that are now making a big difference in our community.
Even us fathers with our ragtag fatherhood program, when we showed up, we began to speak for the community because we were there. And what happened is other organizations started to realize, wait a minute, okay? We got fathers in this community, because people were saying, oh, you can't find the fathers, they're not here, they're absentee fathers and all this stuff. Wait a minute, they're here, you just don't know them. So when we started to be at the table where these issues were talked about, things started happening. I used to go to conferences and stuff, and I used to talk about Schenectady, and I would talk about it, and like people would say like it never was happening anywhere else. And it made me proud to be a part of what we do here. And the fact is that it was so innovative.
A lot of people don't understand about Schenectady is, when you talk about the Electric City and G and all these things, we've always kind of been leaders in innovation.
The foundation has been the major player in achieving that attitude of cooperation and collaboration.
I don't think that there are too many foundations out there anywhere that were so locally or are locally responsible to needs as the Schenectady Foundation is.